Hi, and welcome to On Call. I'm Dr. Rob Epstein. We're focusing today's show on Alzheimer's disease because it is a disease with true unmet need. Despite a few marketed drugs, most people with this disease continue to progress, which results in the loss of memory and other cognitive abilities, as well as a general loss of independence. And this has a staggering impact on families and the healthcare system. If we could shave just 5 years off the onset of this disease, we could cut in half the $20 trillion in expenditures that's been projected between now and 2050 to treat this disease. But hope may be on the horizon. There are now 75 to 100 drugs under development today for Alzheimer's disease. Researchers are looking at various drug markers to identify and treat patients earlier, while drug companies are now hitting the disease with different mechanisms of action. In today's show, we'll take a look at the Alzheimer's diagnostic and the drug pipeline. Today, to make the diagnosis of Alzheimer's disease, there really are 4 criteria. 1, it has to have an insidious onset. 2, there has to be a clear-cut history of progressive decline in thinking. 3, there's an inability to do something very specific, like retain information or learn new information. Lastly, you got to rule out everything else. Did the person have a stroke? Are they vitamin B12 deficient? Or in the elderly, are they hypothyroid, which sometimes can look like dementia? So let's hear from Medco's own Dr. David Mazzina, a specialist in neuroscience, who's been tracking some of these diagnostic tests under development.
The diagnosis of Alzheimer's disease has been a real challenge, particularly because most of the tests that we have are pretty subjective in nature. New tests will include biomarkers. Biomarkers are things in the body that can be measured, and they're reliable indicators of the absence or presence of the disease or the risk of later developing the disease. Biomarkers in Alzheimer's disease include cerebrospinal fluid analysis and brain imaging techniques like MRI and nuclear medicine scans, which include things like amyloid imaging. All of these tests will help us to measure the accumulation of beta amyloid in the brain or detect signs that there's active nerve injury or degeneration going on. These tests are all under study and being refined in clinical trials.
Isn't it interesting that we're trying to identify patients earlier, even before the damage is done? The drug industry is really moving along after no new drugs have come to the market over the past 7 years. So how are drug companies attacking this problem? Well, the current thinking is that Alzheimer's patients have too many amyloid plaques clogging up the brain, and this happens at least 10 years before the symptoms occur. Closer to the time of symptoms, a protein called tau can get mixed up in these plaques. So many drug companies are focusing either on the amyloid and attacking that amyloid, or on the tau and attacking the tau, or they're trying to clear them out faster. So let's talk with the Chief Medical Officer at Pfizer about these new drugs, including their own new product under development.
So it's believed that this beta amyloid deposit in the brain is one of the hallmarks of Alzheimer's. And so, simply stated, if we could reduce the accumulation of beta amyloid in the brain by either reducing its production or removing it from the brain, that we could actually affect or modify the course of the treatment. Pfizer has a compound in development in phase 3, bapineuzumab, which is a humanized monoclonal antibody. It is an antibody that's targeted at effectively going in, if you would, and pulling out the beta amyloid. This is an important advancement, we think, and are excited to be working in partnership with Janssen Alzheimer Immunotherapy on this project.
Many of these new drugs are already in their final phases of development, and they may be coming to the market in the next 3 to 5 years. And isn't it cool that we can target subpopulations and potentially use personalized medicine to provide hope to millions of people with this condition? So to sum it up, there are many new drugs and many diagnostic tests under development that have the potential to make a dramatic difference in the course of this disease. Stay tuned to On Call for updates as these innovations move down the pipeline. Well, that's it for this episode of On Call. From all of us here at the Medco studio, Thank you so much for joining us, and take good care.